Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, we are going to see whether can we do IUI cycles back to back in consecutive months, or we need to take a break in between two IUI cycles. Now, we know that IUI is a very basic technology of assisted reproduction in which the tubes are patent, the egg count, the egg reserve is good, and the semen is absolutely fine. But in spite of keeping natural intercourse, if the lady cannot conceive for more than a year's time, then IUI can be suggested. Generally, up to 3 cycles of IUI are advised for better pregnancy rates. Now, if a lady has failed the first cycle of IUI, because we know that IUI success rates are 15 to 20% in the best of the centers. So, if a lady fails the first IUI, should she go ahead and do the next IUI in the immediate cycle after the periods, or it is good enough to take a break and try in the next cycle? So what happens is, whenever we give IUI medication, we start giving medicines to increase the egg count and quality right from the second or third day of the menses, and we sometimes do give injections to improvise the quality along with the rupture or the trigger injection. Now, how do we decide this? Whenever, suppose a lady fails IUI, immediately when she gets her periods, during the periods, the sonography can be done, which is known as the antral follicular scan. If your ovaries are silent, it does not show a cyst or an unruptured cyst from the last cycle, or if the medication is completely washed out of your body, then it is a good chance that you may conceive in the immediate next cycle. If we see a cyst somewhere or an unruptured follicle, or if the egg count is too low or too high, then it is always better to wait for complete washout of the artificial hormones and then go ahead in the next subsequent cycle for the second IUI. So basically, all in all, it all depends on how good is the ovarian reserve, what is the time taken for the pregnancy, what is the age of the patient, and any super added factors like endometriosis, and so on and so forth. So this will be completely decided and highly individualized for each patient depending on all these factors, whether to do IUI back to back or wash out one cycle and go in for the next. Thank you.